English for talking to a doctor. Visiting a doctor can be stressful, especially when you're in a foreign country or speaking a second language. Knowing the right English phrases and vocabulary can help you express yourself clearly and get the treatment you need. In this article, we'll explore essential English for talking to a doctor. 1. Making an appointment. When you need to see a doctor, you usually start by making an appointment. Common phrases. I'd like to make an appointment with Dr. Smith. Is there any availability this week? I need to see a doctor as soon as possible. It's an emergency. Receptionist might say, "What is the reason for your visit? Can you come in at 10 a.m. tomorrow? Please bring your ID and insurance card." 2. Describing symptoms. Describing your symptoms accurately is crucial. Here are some useful phrases and vocabulary. General symptoms. I have a headache, fever, cough, sore throat. I've been feeling dizzy, tired, weak. I'm experiencing chest pain, stomach pain, back pain. I feel nauseous. I think I'm going to vomit. I have trouble breathing, sleeping, swallowing. Pain-related phrases. It hurts when I move my arm. The pain is sharp, dull, throbbing, constant. The pain started 2 days ago. 3. Medical history. Doctors often ask about your medical background to understand your condition better. Questions a doctor may ask: do you have any allergies? Are you taking any medications? Have you had this problem before? Do you have a history of diabetes, high blood pressure, heart disease? How you might respond. I'm allergic to penicillin. I take medicine for high blood pressure. I had surgery last year. 4. During the examination. Doctors will often explain what they are doing during the checkup. Doctor might say, "Let me check your temperature. Blood pressure. Take a deep breath. Does it hurt here? Please lie down on the bed." Useful phrases for you. That hurts. I feel better when I rest. I've been feeling like this for a week. 5. Understanding the diagnosis. Once the doctor has examined you, they'll tell you what they think the problem is. Doctor might say, "You have a cold, the flu, an infection. You need some blood tests. An X-ray. It's nothing serious. You should take these antibiotics for 7 days." Questions to ask. What's wrong with me? Is it serious? Will I need any tests? What should I do to get better? 6. Getting prescriptions. If medication is needed, the doctor will give you a prescription. Doctor might say, "I'm prescribing painkillers. Take 1 tablet 3 times a day. Don't drive after taking this medicine." You might ask, "Are there any side effects? Can I take this with food? Do I need to finish the whole course?" 7. After the visit. Sometimes you need follow-up care or further instructions. Useful phrases. When should I come back? Should I rest or go to work? Can I exercise? What foods should I avoid? 8. Important vocabulary. Conclusion. Being able to talk to a doctor in English is an important skill, especially when you are living abroad or traveling. Learn the key vocabulary. Practice the common phrases, and don't be afraid to ask questions if you don't understand. Your health is important, and clear communication can help you get the best care possible. Mastering Medical English, a complete guide to speaking with doctors. Whether you're traveling abroad, studying in a foreign country, or living as an immigrant, knowing how to communicate with a doctor in English is a vital life skill. Health concerns can arise at any time, and being able to explain symptoms, understand advice, and follow instructions properly can make a significant difference in your care. This comprehensive guide will help you build the confidence and vocabulary you need to talk to medical professionals in English, step by step. Section 1. Starting the conversation, setting up a medical visit. Situations where you might need to speak to a doctor. feeling sick or in pain, needing a medical checkup, following up on a previous appointment, seeking a specialist. Common expressions to begin. I think I need to see a doctor. Can I schedule a checkup? Please, I'm not feeling well and would like some advice. Is the doctor accepting new patients? Receptionist may respond with, what seems to be the issue? Can you come in this afternoon? Do you have health insurance? Section 2. Explaining how you feel. Describing illness and discomfort. Being clear about your symptoms helps the doctor understand what's going on. Here's how to describe your condition in English. How to begin. I've been feeling unwell since yesterday. Something doesn't feel right. I've been in pain for a few days. Useful expressions by body area. Head. I have a pounding headache. I feel dizzy and lightheaded. Chest. I have tightness in my chest. It hurts when I breathe deeply. Stomach and digestion. I'm feeling nauseous. I have stomach cramps after eating. Muscles and joints. My back feels stiff in the morning. There's swelling in my knee. Section 3. Describing the pain. Words that doctors understand. Pain can vary, and doctors need to know the type of pain to diagnose properly. Descriptive vocabulary. Sharp. It's a sharp pain. Like a knife. Dull. The pain is dull and constant. Burning. It burns when I urinate. Throbbing. I have a throbbing headache. Intermittent. It comes and goes. Doctor might ask, when did it start? How would you rate the pain from 1 to 10? Is the pain getting worse? Section 4. Discussing medical history. Sharing important background. Doctors often need to know about your previous health conditions to provide proper care. You might say, I have a history of asthma. My father had heart disease. I was hospitalized last year for surgery. I'm currently taking blood pressure medication. Useful terms. Chronic. A long-lasting condition, e.g., chronic bronchitis. Allergy. Reaction to food, medicine, or substance. Family history. Diseases that run in the family. Section 5. Undergoing the examination. What to expect. During the checkup, the doctor might ask you to perform some actions or explain what they're doing. What the doctor might say. Open your mouth and say, ah. Take deep breaths while I listen. I'm going to check your blood pressure. Lift your shirt so I can examine your abdomen. What you can say. It hurts right here. I feel pain when I touch this area. That position makes it worse. Section 6. Tests and procedures. Understanding recommendations. Sometimes the doctor will recommend further tests. Examples. We'll need to do a blood test to check for infection. You should get an X-ray of your chest. An ultrasound might help us see what's going on. I'm referring you to a specialist. You can ask, is the test painful? How long will it take to get the results? Do I need to prepare in any way? Section 7. Receiving the diagnosis. What's the problem? Understanding your diagnosis is critical. Doctor might say, it's just a common cold. You have a mild infection that needs antibiotics. There's inflammation in your joints. You may have an allergy to pollen. Helpful responses. Questions. What does that mean? Is it serious? Can it be treated? Do I need to stay home from work? Section 8. Medication and treatment. Following instructions. After diagnosis, you'll usually get treatment instructions or a prescription. Doctor might say, take 1 tablet twice a day after meals. Apply this cream to the affected area. You should rest and drink plenty of fluids. Come back if symptoms don't improve in 5 days. You might ask, are there any side effects? Can I take this with other medicines? Is it safe during pregnancy? Section 9. Aftercare and follow-up. Staying on track. Once treatment begins, You might need a follow-up appointment. Say, when should I come back? Should I continue the medication after I feel better? Can I travel while taking this treatment? Is there anything I should avoid? Section 10. Emergency situations. Getting urgent help. In case of emergencies, it's important to act quickly. Call emergency services or go to the ER if you say, I can't breathe properly. My chest hurts badly. I'm bleeding heavily. Someone has collapsed. Bonus. Must know vocabulary list. Final thoughts. Learning how to talk to a doctor in English isn't just about memorizing vocabulary. It's about being able to express yourself confidently when it matters most. By mastering the phrases, understanding medical terms, and practicing conversations, you empower yourself to protect your health, wherever you are in the world. Remember, it's okay to ask the doctor to speak slowly or to repeat something. Your health is too important to misunderstand. If you found this guide helpful, don't forget to like, comment, share, and subscribe to our channel. Your support helps us create more valuable content for you. Let us know in the comments which daily conversation topic you'd like to see next. See you in the next video.